Hello guys, today I am going to discuss with you how you can prepare for and manage combined stations for your Plab 2 examination. So if you want to perform well in your Plab 2 examination, watch this video till its end. So let's start right now. How to manage combined station. I am Dr. Raja Nadir Jalal. First of all, you need to know what is a combined station. A combined station means where you have to take history, perform a complete examination, and discuss your management plan with the patient or the examiner. It is different from other stations in Plab 2 examinations, in which you only need to mention examination and the examiner will give you the findings. In combined stations, time management is the biggest issue which most of the candidates struggle with. In combined stations, the examiner assesses your interpersonal skills, data gathering skills, and management skills as usual. But most importantly, how well you can perform an examination and your time management skills. So this video is all about these things. What Plab examiner notice and what is the criteria? The examiners notice that you are not taking too long over history taking at the expense of examination and management. They also see whether you can recognize issues in the question and pick up significant abnormal findings and their implications. They also notice that you can perform physical examination competently and use instruments proficiently, and you can make a correct diagnosis or identify an appropriate range of differential possibilities. And they also assess whether you can develop a management plan, including follow-up and safety netting within a time limit. And most importantly, your communication skills, how you communicate with your patient about your findings, about your management plan. I want to tell you about the things which you must remember in combined stations. So never forget GRIP's approach. It is also very important in combined stations. Your interpersonal skills you should apply at every step, especially when you are performing your examination. You don't need to take a detailed history in combined station. You just need to take focused history. And you need to give detailed explanation about the examination before you start. And you need to explain to your patient what is the purpose of examination, what is the adequate exposure. You need to ensure privacy, mention about chevron, and you need to take consent before starting the examination. And accuracy. Your examination should be in a logical order and as gentle and quick as possible. And you must make a shared and individualized management plan, including safety netting and follow-up. Always remember, in combined station, data gathering, management, and interpersonal skills all carry equal marks. So don't miss any of the component. Take care of all of these. So if you want to learn about all these things, keep watching this video. And at the end, I am going to give you a bonus tip how to pass combined stations in Plab 2 examination. First of all, I am going to tell you how you can use GRIPs in combined stations. You already know that GRIPs mean greeting. So you need to greet the examiner and show your ID. Then you need to greet the patient or simulator. R is for rapport, I for introduction and identity. Introduce yourself and confirm patient's name and age. Then explain why you are here and ensure privacy, and S is for social courtesy. So GRIPS is important in every station, but I would like to highlight some points which are important regarding to stations where you are going to perform a thorough examination. So how you can build a rapport and how you can show social courtesy during performing an examination. So first of all, you need to explain to your patient the purpose of the consultation and examination. Then you will explain the procedure, what you are going to do, and then what are the steps involved, like looking at your leg and touching your leg and performing some movements and doing and asking you to do some maneuvers. And then you will explain what exposure you need below thighs, below mid thighs, or you need like below waist. So and depending upon the examination you are going to perform, you need to explain about adequate exposure. Next thing is that in some stations you need to clearly explain to the patient that I might need to come closer to you during the examination, and my hand might touch, for example, to your face in fundoscopy. So this is all building rapport and showing social courtesy during your examination and showing to your examiner that how well you are prepared. You also need to explain that I will be as gentle and quick as possible, and I will ensure your privacy, and I will have a chaperone with me during the throughout the examination. Then take consent in the beginning, but also importantly, you have to take consent before touching any body part. For example, I am going to touch your tummy or I am going to touch your leg. Is that okay? And also you need to take consent when you are changing your position. For example, when you are going towards the side of the patient, you are going towards the back of the patient, you need to take consent. I am going towards the back to do some examination. Is that okay? So this is important in examination stations. And another important thing that whenever you touch your patient, before that you need to warn the patient, I am going to touch your leg, I am going to touch your tummy. And then you need to warm your hand by rubbing, and then you can touch your patient. So these are rapport and social courtesy during examination and combined station. Other things you also need to show to your examiner about your social courtesy. You need to ask your patient if you have any pain anywhere before I start. You can ask about any preference of right or left when, for example, taking blood samples or passing IV cannula. Then you need to say thank you repeatedly during your examination, almost after every step. And don't forget to say sorry whenever patient feels pain. Say, I am sorry, and then again ask, may I proceed? And very important that you need to cover your patient. You need to take care of dignity of your patient. Even if you are performing examination on a mannequin, you need to show that this is a real patient, right? And whenever you finish, cover the patient. Or you, if it is a real patient, then you can ask the patient to redress. And don't forget to say thank you at the end of the examination, right? So this is how rapport and social courtesy works in examination scenarios. Now I am going to explain further how you can deal to combined stations with an example. I will discuss diabetic foot examination. So in this video, you are not only learning about how you can manage combined stations, but you are also going to learn about diabetic foot examination scenario. So this is 2-in-1 video. Right. So how to manage combined stations, and with an example, a 50-year-old man comes for his diabetic annual review. Take history, do diabetic foot examination, and discuss your management plan. Right. So first of all, I am going to tell you how you should analyze, how you should do analysis of a station. Right. So what are the issues in this station? You need to know. First one, time management. Quickly think how much you should spend on history taking, how much you should spend on examination, and how much you should keep for your management. So how much to spend on a focused history? Maximum 1.5 minutes or 2 minutes. And you should think about how to perform a gentle and quick examination in a logical order. It shouldn't take more than 3 to 4 minutes. And then how much you should spend on management, you will find it very hard to keep 2 minutes for management. Right. And another issue is that what are the components of annual diabetic review? If you don't know, then you will not be able to give your management plan. Another issue is what are the differentials, right? So if a patient in a station of diabetic foot, you need to think about diabetic neuropathy. You need to think about vitamin D deficiency causing neuropathy, then alcoholic neuropathy, then autonomic neuropathy, and chronic kidney disease also may cause problem with the feet. So, and then another issue is how to take a focused history, leaving out all the unnecessary details. Another issue, how to perform a quick examination. It may include general physical examination, diabetic foot examination, and fundoscopy as well. And you need to identify the positive findings from the history and any test results available. And you need to identify the other risk factors, lifestyle issues, and positive examination findings such as peripheral neuropathy or retinopathy or nephropathy. And another issue is making an effective management plan for this particular patient and to impress your examiner. So many issues, right? So how you will manage in 8 minutes? Okay, let's start. A 50-year-old man comes for his diabetic annual review and you have to perform diabetic foot examination. So what is a focused history in this station? Just ask few questions. Since when you have diabetes and how do you manage it? With diet, medicine or insulin? Is it well controlled? Do you check your blood sugar regularly? And what was the last time you checked it? And was it before or after the meal? And have you been going for your annual checkups? Do you have any complication of diabetes? Any shortness of breath, chest pain, or any problem related to heart, kidneys, eyes, or any foot problems? Any problem with sexual functioning? Then quickly ask, do you have any other medical condition like high cholesterol, high blood pressure, any blood disorders, or clots in your legs, or pain on walking in your legs? Are you taking any other medications? Are you allergic to any medications? And tell me about your diet. Do you exercise? Do you smoke? And what about alcohol consumption? And whom do you live with? And any family history of stroke or heart disease or kidney problem. So this is focus history. You need to collect these information within 1.5 to 2 minutes. Then comes examination. Ideally, you can say that ideally I would like to check my patient's pulse and blood pressure, height and weight for body mass index, and I will check available blood glucose readings. I will check HbA1c and other test results. And I would like to do examination of the back of the eyes, that is fundoscopy, and I would like to perform diabetic foot examination, which include examination of the feet and legs. Then you will perform diabetic foot examination within 4 minutes. I would recommend that how to perform these examination. You can go on YouTube and watch videos. I found following resources very useful: Dr. Ankur's videos, Geeky Medics, Dr. Swami's videos, and Bromley's videos. So how to perform exactly a diabetic foot examination? You can watch these videos, how quickly they perform this examination and how they apply interpersonal skills. But I can only show you in this video a scheme for diabetic foot examination, right? So first of all, you need to explain the purpose of the examination, then what are the steps involved, then exposure and mention privacy, chaperone, take consent, and then do inspection. In inspection, you will check muscle wasting, any deformity, loss of hair, shiny skin, any redness, swelling, scars, or sinuses. Then you will check nail changes, fungal infection between the toes, and then you will check for pressure sores on the sole and on the heel. After that, you will perform palpation. And palpation, you first of all, you will check temperature, then tenderness, and you will check pulses. After that, you will check 4 sensations: fine touch, you will check with cotton vest for monofilament, then pain with the neurotip. You will check vibration sense with tuning fork, and you will check joint position sense. And then in that you will ask the patient to walk a few steps to examine the gait, and then you will also examine patient's shoes to check whether they are good fitting or ill fitting, right? After that, you will mention what investigation you would recommend. Investigations, you can say that I would like to check HbA1c to check blood sugar control in last 3 months. Then I will also advise cholesterol levels and liver function tests, a kidney function test, and a urine test for albuminuria to exclude nephropathy. So these are the tests which you need to advise to every patient when a patient comes for diabetic annual review. Right. So next comes how to discuss management plan for annual diabetic review and diabetic foot in a combined station in 2 minutes. So it is really difficult. You will hardly left with 2 minutes. First of all, I want to tell you what your effective management plan should include. You need to explain the findings and need of review of the medicines. Then you need to involve the patient in each step of the management plan by asking, what do you think? Is it all right? How does it sound? And then you will explore eyes of ideas, concerns, expectation of the patient. Then you will mention that we might need to add some other medication to control other risk factors such as high blood pressure and high cholesterol, but it will depend on your test reports. You will need to give lifestyle advice, and you will offer help and support if patient consider changes. Then you will check understanding, and then you will mention about referral if required to dietitian, podiatrist, ophthalmologist or nephrologist, and you will do safety netting and arrange follow-up. So this is effective management plan of a diabetic annual review and diabetic foot examination station. But you will use a golden first minute strategy. What is that? You will explain all your positive findings, your assessment and your positive findings and your management plan within the first minute quickly. So how you will do that? Mr. X, diabetes can reduce the blood supply to your feet and can cause a loss of feeling, and this condition is called peripheral neuropathy. Unfortunately, you have developed this problem, and have you heard about it? Then you can explain. This means you may not notice if your foot is sore or injured, and foot injuries don't heal well if you have peripheral neuropathy. And Mr. X, there are a few things we need to talk about today, such as your diabetic control, your medicine, your lifestyle, foot care, and when you must see your doctor urgently. We might not be able to go through everything today, but don't worry, we can make another appointment. So in golden first minute, you have mentioned about your assessment and you have explained peripheral neuropathy, and you have told your management plan to the patient and examiner that you will talk about diabetic control, medicine review, lifestyle changes, food care, and you have done you will go through safety netting and follow. So now you don't need to worry about whether you can finish within 2 minutes or not, right? So utilizing golden first minute smartly is very important in combined stations. Now, if you are left with time, then you can explain these things in a little bit detail, and I will tell you how to do that. So you can say, let's discuss first about your foot problem and how to take care of your feet. The risk of problem getting worse can be greatly reduced if you are able to bring your blood sugar level under control. It's especially important to look after your feet if you have diabetes. I will give you a leaflet about how to take care of your feet if you have diabetes. Is that all right? And it is also important to ensure that your blood pressure and cholesterol levels are also monitored and controlled with medication if needed. So we will review your medications after your test reports. Are you following me, Mr. X? Do you have any questions so far? Then coming to lifestyle, coming to diet and exercise, you should aim to eat a healthy, balanced diet and keep active. This can help you to manage your diabetes and reduce the risk of getting problems with your feet and legs. Smoking impairs the blood circulation and can seriously worsen your foot and leg problems. If you consider quitting, we can help you with it. Excessive alcohol consumption can also make your foot problem worse, and it is advisable to reduce it to minimum. and regular follow-ups are very important, and if needed we can make appropriate referrals to a dietitian or ophthalmologist or a podiatrist as and when needed. Then safety netting and follow-up, and please seek immediate treatment if blisters or injuries don't heal quickly. You should see your doctors urgently if you notice breaks in the skin of your foot or discharge seeping from the wound. The skin over part or all of the foot changes color and becomes more red, blue, pale, or dark. Or if you notice extra swelling in your feet where there was a blister or injury, and if there is redness or swelling around an ulcer or in an area where you have previously been warned to seek immediate attention. This is how you do safety netting, right? And after safety netting and follow-up, you can finish your station. I just want to tell you foot care tips for a diabetic patient. Keep your feet clean and free from infection. Wear shoes that fit well and don't squeeze or rub. Ill-fitting shoes can cause corns and calluses, ulcers, and nail problems. Never walk barefoot, especially in the garden or on the beach on holidays, to avoid cuts, and try to avoid sitting with your legs crossed so you don't constrict your blood circulation. Cut or file your toenails regularly and get corns or hard skin treated by a podiatrist, not do it by yourself. And it is important that you see a podiatrist at least once a year. You can ask your GP to refer you to a podiatrist on your annual review. So guys, this was all about diabetic foot. And at the end, don't forget to say thank you to the simulator and the examiner, and hopefully you will pass this station. Now, as I promised, I am going to give you a bonus tip for combined stations. So if 6-minute bell rings and you haven't finished your examination yet, what should you do? This is an important question, right? So the answer is, if you have reached in your examination up to the point where you have picked up the positive finding for your management plan, then stop the examination and just explain to the examiner that ideally I would complete my examination by doing this, this, and this. However, because of the sake of time, I will proceed to discuss the management now. But if you haven't reached up to the point where you have picked up the positive findings for your management plan, you need to continue the examination, because without a positive finding, you cannot discuss your management plan. So practice, practice, and practice to reach to a point in your examination where you can at least pick 1 or 2 positive findings. So this all depends on your practice before your examination, right? And what does it mean by positive finding? Positive finding means, for example, you have picked up numbness on feet or leg below mid-shin. Or for example, in another station, for example, urinary catheterization, if you have passed the urinary catheter but still have to inflate the balloon with distilled water, in both these cases you can finish your examination at or finish your procedure at 6 minutes bell, and you can mention rest of the steps verbally and can proceed to discuss your management plan with your patient or your examiner as mentioned in the examination. So this was a bonus tip, and thank you guys for watching this video. I hope this is beneficial, and thanks for watching, and don't forget to subscribe to my channel and press the bell icon and like button. See you next time with another interesting video. Thank you and bye bye.